And knee cartilage or cartilage in the human body, the articular cartilage has been a very vexing problem for the doctors and the surgeons for centuries. And still, very fascinating. We still don't know how it works, why it works that way. I think around 3 years ago, during the peak COVID, I think first wave I was involved in a meeting pan Europe where all the top knee experts and regenerative medicine experts were having a Zoom meeting. And the first time I heard about this new concept where the fat of the human body can be taken and the cells from the fat can be harvested, and those cells can be a game changer in the treatment of arthritis, where you don't need robotics, but that's one end of the spectrum where you can treat the knee arthritis without actually surgery, with a very minimal, less is more, that kind of a concept. So that's the first time I heard. I subsequently heard again a year and a half ago, when, because I'm quite academic, even during COVID and everything is shut up. I organized around 4 international meetings, in the country.
Wow.
My center trained around 10,000 orthopedic surgeons in India and Southeast Asia. So it was a huge kind of accomplishment for a small unit like myself. So that was really fantastic. So during that time, one of the meetings, one group of scientists, they came and presented their work, and I was really blown over by the kind of academic acumen they had and things like that, where they were looking at this fat and manipulating the fat minimally and getting what they call as the SVF, and then sort of grafting it to the knees and getting a good outcome. And I'm a very passionate believer of evidence-based medicine. I look at all the papers, the statistics, whether they've done it right, is there a con involved, or is it genuine. So I really go to the end of the thing, the end of the earth, to make sure the technology is right for my patients.
Hi, welcome to the Idea Sandbox podcast. I have with me Dr. Srikanth K N on the podcast today. It's part 2 of the conversations that we had. Dr. Srikanth is a fellow of the Royal College of Surgeons, England, FRCS, as is popularly known as. This is a conversation that I wanted to have to discuss some of the challenges that, as he sees it, in the Indian healthcare system, and what kind of solutions we can come up with. I was just curious about a variety of things. I have been personally affected by the Indian healthcare system due to various interactions with it, myself and my relatives, and I think there's a lot of room for improvement, and I wanted to hear it from an expert as to what his prescriptions are, his recommendations are, and he is a candid individual. You will see in the podcast. I hope you can take something useful away. Cheers and love from the Idea Sandbox. Thank you. We were talking about the things that we want to get into today. Let's get into the first, I think, juicy topic. What made you move back from the UK, practicing medicine in the UK, back to India? As I understand it, you've practiced being a doctor there for 14 plus years. And then at some point you moved back and you kind of, I don't know. I'm just curious, what made you move back?
Same region in the southwest of the UK. I was coming close to my exit exam, which is the FRCS Orth exam, which I completed. And after completion of that exit exam, which was the last exam an orthopedic surgeon sort of takes, I went on to, like all other local surgeons in the UK, do fellowships. And I was always fascinated by joint replacement surgery, hip and knee surgery. And hence I started my first fellowship in Plymouth Teaching Hospitals. It's called Derriford Teaching Hospitals in the south coast of the UK. And it was a General Medical Council of the UK recognized fellowship. And this was in 2011 when I did quite a lot of independent operating using computer-assisted surgery and robotics, which was quite new at that time. And I really enjoyed it. It was a fascinating aspects of my life where I learned how to use the computer navigation. Yeah, that's good. Okay, yeah. So I'll carry on. If it happens 3-4 times, then we'll call it. Okay,
yeah. Sounds good.
Yeah, so great. I moved to Derriford Teaching Hospitals, which is in Plymouth, which is in the south coast of the UK, and very fortunate to do this General Medical Council of the UK recognized fellowship in navigation and robotics, and learned at that time, way back in 2011. That the human knee is a 3-dimensional structure, and it needs a three-dimensional solution, not a two-dimensional solution. And that was my takeaway, having done around 400, 500 navigated surgeries of the knee and the hip, and also a lot of revision surgeries. My trainer was a fantastic human being and a great revision surgeon. So it was really enjoyable. From there, I moved to Bristol, where I did another fellowship with the UK and European Hip Society. He was a big man. He was a designer surgeon for a Zimmer Biomet kind of cup. So he was as big in the world as it gets. So it was really good to understand that aspect of how to become a designer surgeon. What are the people you rub your shoulders against when you meet class acts of surgeons like him, Mr. Everett Smith. So I worked with him for 1 year, and with his colleague, Dr. Anthony Ward, who is the director of pelvic acetabular surgery for the southwest of UK. And again, he's an amazing human being, an amazing surgeon who had a kind of a three-dimensional anatomy of the pelvis in his mind. And, all that he would do is look at few slides of the CT, and on the day of surgery, just put the screw and it will go exactly where he wanted, really. And, that was accuracy. And I've not met a surgeon that caliber, really. So it was fun working with them. And because I was quite senior, they both were quite happy, and they're both busy, so they'd just leave things on me. So, Shri, carry on with knee replacement surgery, carry on with hip replacement surgery. So it was good to have an independent operating in the UK on the local white population, even when my bosses were away, and gave a lot of confidence, really. And having trained in Plymouth, it was very handy for them to give this additional responsibility to me and not worry from Europe, oh, what is she is getting up to, what's happening to my patients, that kind of a thing. And in one of the meetings that my boss, ex-boss, Dr. Everett Smith organizes, the Bristol Orthoplasty meet, it's very world famous, which fortunately I bring it to India in the last 5 years, to India and Southeast Asia. I met a prof from Germany, Prof. Gurka, and Prof. Gurka doesn't need any introduction in the orthopedic world. He's one of the two single-stage revision surgeons for the infection. So he runs, he's a head of an endoclinic in Germany, which is in Hamburg. And he, with Dr. Javed Parvezi, is the biggest name in the joint replacement world as far as, infected revision is concerned, where they take the infected implant out and put a new implant in the same setting. And you need an extremely high level of expertise to do that. And Dr. Javed Parvezi, well known in US, he's from the Rothman Institute, and they're amazing human beings. And it was great to work and get insights from Dr. Gurka and learn this rare act. And because at that time in UK in 2013, not many surgeons even in the UK were able to do the single stage revision. So it was beyond their competence level. So it was nice for me to learn something which is very advanced. And if I look back in the last 10 years, I don't think there are many surgeons in India doing that, actually, even now. So this is the complexity of the work I sort of get into. And you asked me a question, why, with all the, I was a consultant in the UK with a very handsome salary and everything. Why did you come back to India? And I think it's an excellent question, really. And I think there are a few reasons for that, and one of the biggest reason was that, I sort of belong to a spiritual organization called Sri Ramchandra Mission. And I had my spiritual trainer, Parthasarthi Rajgopalachari, who had established ashrams in more than 120 countries at that time. But the world headquarters was in Chennai at that time. And I was very close to him. And he's been my guiding light for more than a decade and a half, even at that time. And he was not well. He had some kind of a issue with his health. And every time I used to come to India, apply for this and that, the flight tickets and all. So it was getting very, very tedious. And I really want to be close to my spiritual guide, during his time, and he was unwell. And in fact, he used to call me as his orthopedic surgeon. So additional kind of responsibility really for me. So I really want to be close to him. When he was not well, I decided that, I need to be there. I can't be traveling from UK every time to Bangalore and to Chennai, but it's better to be there around him when he needs me. So that was one of the main reason. And in fact, my center, what we call SSOC, or Sarthi Super Specialty Orthopedic Center, is also named after him. Parthasarthi Rajgopalachari is his name. So Sarthi I took and I made it into Sarthi Super Specialty Orthopedic Center, or SSOC. It's a registered body now in Bangalore and Karnataka and India. So that was one of the main reasons. And the second reason was my mom. My mom was elderly. and I'd lost my dad a decade ago, during my basic surgical training in Great Yarmouth. And, unfortunately, because of the flight and delay and things like that, I couldn't see the loss of my dad. I couldn't be there for the funeral because of the Hindu tradition. They do all the things very quickly within 6 to 8 hours. So it was impossible to get to Bangalore before that time. And that from that experience, I really wanted to be close to my mom and be with her during her sort of last few decades or something, just close to her. And that was like pulling me back towards Bangalore. So those were two big reasons actually. But incidentally, I happened to meet Dr. Pratap Reddy, who's the chairman of Apollo Group of Hospitals. And the Apollo Group, they come every year to UK and to US to poach doctors, highly qualified doctors to their groups in India. And he's a very inspirational character, Dr. Pratap Reddy. And we met in a hotel next to the Indian Embassy in London. And he was telling all the people that, look here, I'm a doctor. I was from US. I'm a cardiologist. I do stents. And every time I was in US, and I used to travel to India in the 70s and 80s, and putting stents on people because India was not developed at that time, and there's nobody who could put a cardiac stent in the vessel. And all the politicians and big wigs used to travel to US and they get it done. And even people used to travel, and a lot of expense for them traveling, flight, visa, medical tourism, so much. Then Dr. Kyani Jain Singh was the president at that time. In some 80s, he said, "Sir, why we should travel to US? Why don't we give you free land in Chennai? You come and set up a hospital there, and you can do the same service to our people." So then, with the help of Kyani Jain Singh, the government moved the machinery and they created Apollo Hospital in Chennai, I think in Thames Road or something. And he moved. And the rest, as he said, was history. And at that time, when I met him in 2012 or 20, look here, Dr. Srikanth, I'm like you. Yes, I'm not great. I'm like you. And, I'm like all of you. And you couldn't be in UK becoming consultants if you're not good enough. Okay. And you're good enough. That's why you're all at top of the game. So when I can do it from US, establishing 80 hospitals,
wow,
and serving the people of country and also making decent money, why can't you do it? And that was really inspiration. That was like, I said, wow, if he can do it, why can't I do it? And I can do it as well. So it gave me belief that, I can move back to India and serve my people, because I completed my training. I'd taken a consultant job, and, all that was, in the Indian terms was to make money, that was the only thing left really. So I said, these are the reasons, my spiritual guide is not well. I could be close to him. My mother she's getting old. I can be close to her. And then I'd met Dr. Pratap Reddy, and they offered me a post in the Apollo Hospital, Bangalore. And that sort of, was like icing on the cake. And I sort of made a decision to move back. And my daughter was also like 7-8 years. And my son was, into 10, 11 years. And sometimes, if you delay too much, the children find it very difficult to adapt to a developing world,
Right.
So I didn't wanted them to be hit with
Yeah, I wrote down as you were talking through this stuff, like, thank you for walking me through all of that. Like, I had many like kind of points. So you mentioned like you went to the UK to train, but you had to start from scratch. Can you describe why you had to start from scratch?
So I think, the great question, really. I think the medical systems in different part of the world have got their own kind of idiosyncrasies, really. So, although in India, because we are a colony of the UK, we were trained in English. And, I'm from a very prestigious medical college, Bangalore Medical College and Research Center. This is #1 in Karnataka. And the medium of instruction was English. And I was like a rank holder throughout, like, I scored like the 32nd rank in SSLC, and then 20th rank in the PUC, then 59th rank in the CET, 141 for engineering, and, medicine was 59, and got straight into Bangalore Medical College in first attempt. So I would always maintain the kind of standard. So despite all these things, there is an element of distrust between different medical boards, and the UK doesn't, take every medical board as on par to themselves. And again, it is on both the sides, really. I think when somebody does any kind of training in the UK and wants to come back, with the greatest of the skills, the Indian Medical Board treat in the same way. They try to undermine that. For example, I'll give a very famous example of one of the best cardiologists in the country, Dr. Naresh Trihan. He is the director of Medanta Heart Care in New Delhi. And he is one of the best cardiologists in the world, and definitely in Asia, and definitely number one or number two for India. And because he's trained extensively in the US and Europe, and he didn't have an Indian kind of postgraduate degree, the Indian system doesn't recognize him. Can you believe it?
Wow.
He can be treating millions of patients and helping and saving their lives, and he can be doing a wonder. But if you ask the regulatory authorities in India, they'll say Dr. Naresh Trihan can't work even as a lecturer in a medical college in India.
Wow,
so can
really?
you imagine, how settled in the country, by using arcane rules, which are really stupid and very counterproductive to the people of India. If Naresh Trihan can't work in India, I don't think which cardiologists have to work in India, really. I really don't know. And that's the regulatory authorities have to sit up and take notice of this and say, why are we following a 1860 system? We are in 2023. We have to leapfrog and change all our arcane rules, which the British left us in 18. For example, we had an Epidemic Act, which was in force in India during the COVID time. And this Epidemic Act was created in 1893. I mean, can you believe it? What are all our babus doing? Sitting there and doing nothing, having chai. Their job is to create an act which is relevant to 2023, not follow the British Act, which was done in 1893 by the colonial occupiers to keep the local people under control. And it was so draconian. Anybody spitting on the street in Bangalore during the COVID pandemic could be arrested, put in a jail with parole, because we are following a British law of 1893. So I think, our leaders at all levels, including the netas and the babus, which are the IAS officers, have to really wake up and say, are we doing our job honestly? Are we serving our country, or are we going back to British rule because we can control people of India, them as slaves like the British did? So we just replace the Britishers, and we are just, we can just, do whatever they did, atrocities, by using old laws, and then do the same thing in 2023. Is that what we want to do? Is that what is called freedom? Is that why our leaders like Gandhiji and everybody lost their life? This is a big question. Our netas, which are political leaders, and the babus, which are administrative, who wield the power in the country, have to really introspect, and then, they have to realize what they're doing. Then only India can become a developed country.
Do you think it's also like some of the responsibility falls on the shoulders of the fraternity of doctors and medical professionals to maybe I'm sure there's advocacy boards and so on to affect these laws and change, or do you think that there exists this kind of institutional, like a framework where you could actually advocate on behalf of the people, advocate on behalf of simplicity, like you mentioned, like remove all these arcane rules, remove some of these draconian laws and stuff like that, and reform them? Like, it sounds like we need a major reform in some of the laws and stuff. And also one of the things I was thinking was that I remember President Obama back in the day saying one of the reasons why some of the the rules, especially in the bureaucratic structures, remain the way they are is because they're benefiting a small group of people, and those people who are benefiting have no incentive to actually go out and change things because it's unpopular. Maybe they're making a lot of money, or there's power, in those different rules and stuff like that. So I'm just curious, what do you think, or have you thought about these things, like as far as like a advocacy movement?
I think Barack Obama has Barack Obama has hit the nail on the head. If this is true in the US, it is 100 times more true in India. Okay. So if you have these kinds of arcane rules, then they can control the people, the population. I don't think doctors have any institutional board or bodies who can represent and say, and nobody will care a damn to that. Okay. Either the netas
really?
nor the babus will care a damn, because that means that they are giving their power to somebody else. And why would they want to give the power? Power, corrupts, and absolute power corrupts
even more. Absolutely, yeah.
I think, I don't think anybody would want to give the power to the doctors. They want to keep the power themselves, and it benefits a small group of people, as you rightly put it. And that's where the democracy has to reform, and that's where the country has to progress, because real need of changes, they're not in the medicine or things like that, but it's not a 1890 leadership and the Babu Dhammi.
Right, right. It sounds like we need a lot of structural reforms, and I'm just surprised that we don't. I mean, now that you explained how you explained it to me, it makes sense that they don't want to give away. It's all about control and power and access to money and power. Like you said, it absolutely corrupts, and it's kind of sad to hear. You know, at the same time, I'm also wondering, do you have any intuitions, Dr. Srikanth, about like how we could go about doing this stuff? Like, is it like a very grassroots movement? Like, could there be a group of senior doctors that could get together and form a small kind of a steering committee of sorts, that can advocate? Or you think this is more like this can't be a grassroots, it has to be a top down, we have to elect the right kind of people who have a vision for where India has to head in the medical? I know I'm jumping ahead because I wanted to cover these questions much later in the conversation. I don't know. I was wondering if you have any intuitions on that.
I think it has to be a top-down approach, really. If you want a single-line answer, sometimes I tweet quite a lot to Prime Minister Modi, and he says he'll become a developed country in 2047. I tweet to him, it's not good enough. It has to be now. The people now have to enjoy the first world life. 2047. I don't know if you will be alive or I'll be alive. What's the saying that India will become developed in 147 or 247? Don't give us hope. Give us reality. Give us good leadership. That's what it's all about.
And even if 2047 is let's say the target, what are the concrete actions we're taking today? Are there concrete actions that are visible and transparent to us that we are working towards that could give us hope? There are, like you were saying, like even this is 2019 COVID time. You were talking about how cardiologists were dealing with infectious disease. Like, that's not a step towards being a developed country. Like, a developed country, you're doing things based on evidence, you're doing things that make sense, you're doing things based on expertise and meritocracy. Like, people who are meritorious in their fields are the ones who pick. But sounds like, well, 2047 would be a pipe dream if we're still acting like, the Babu, the Neta culture, the bureaucratic culture, where a small group of people hold power, right? I mean, this is not, and I'm not, and I guess my what do you call that? My perspective towards this is like, this is not, and I'm not saying anything new here, this is not isolated to the medical field, right? Like, this is probably widespread in other spaces as well. That's why you see some of the dysfunction that you see.
Yeah, absolutely. I mean, say if you can't get a domain expert to do his job, then sorry, you're barking the wrong tree, and then it'll be all your thing will be a pipe dream. Because at least if you look at India, at least the one thing good happening now is that our external affairs minister or the foreign minister is a bureaucrat. He's amazing. He knows how to deal with China, how to deal with US, how to deal with Russia, how to deal with Middle East, how to deal with Pakistan, how to deal with SAARC countries, because he's a professional. You are honoring his skills. Okay. So if you just make a Anguta Chap Neta as a foreign minister, what will he do? He will just go putting Anguta Chap everywhere in the thing, and the country will never progress. So what India has to do is really recognize talent and give them full power, like what they have done to Jaishankar, Dr. Jaishankar. Give them full power, and because they are domain experts, let them take their decision. Like, if they made an infectious disease specialist as the head of the COVID task force, he could have done a better job than a cardiologist or orthopedic surgeon, doing a kind of the thing, because I'm close to this minister, I'm close to this Babu, I'm close to this. That's the least important. When people's lives are at stake. Get the job done. As simple as that.
Right. Well, shifting another topic, another point of curiosity, what drew you towards the orthopedic surgery space? Like, why did you specialize in that space?
I think for this, I should give credit to my teachers. And as I mentioned, I was from a prestigious institution in Bangalore. And throughout I was like a national merit scholar, and hitting very good ranks in 10th standard and PUC, and through the general coming into the Bangalore Medical College. And my professors used to say that you are the cream of intelligence here, that the state has got. That's why you got into Bangalore Medical College. Otherwise, you would never get into this kind of college. And those are very inspirational words. And when we are doing clinicals, like, our whatever you call seventh sem or eighth sem, that kind of a time. When we had orthopedics as a short course for I think 6 months time, we had it. We had one of our great teachers, Professor J.K. Reddy, J. Krishna Reddy, and so he used to come to our class in the Bangalore Medical College and teach. And and he just described one of the very simple tests, which people get if they have arthritis in the head, called as a Thomas test. And he just demonstrated to a patient, in the classroom, and it was so simple the way he explained, and it made so much of logical sense that for me, at the end of his class, I said, "Wow, I had to become an orthopedic surgeon," because it was logical, so simple, so nicely demonstrated, and I was completely blown over actually. And after my return from UK and all, one of the TV channels in India asked me to give a talk about my experience, and I think there's this program called Guru Vandana or something in one of the channels. And I spoke about my professor. He later on became my professor HOD when I was doing PG. And I spoke about him. I said, this is what inspired me to become an orthopedic surgeon. Unfortunately, Dr. J.K. Reddy couldn't watch that program, but his wife was a dermatologist. She watched it and she said, "Hey, look, one of your students is talking about you." And I met him in a conference and he said, "Dr. Srikanth, I'm so happy that at least you remember the teachers. My wife told that she watched the TV program in Canada and you talked about me, and that's the greatest tribute my children and my students can give to the teacher." Mm-hmm. And I think I should really credit him for me becoming an orthopedic surgeon, because he was quite inspirational. And after my MBBS, I did post-graduation. I did work under him. He was a professor HOD, Unit 1 in Victoria Hospital. And then when I went to the UK also, I was fortunate enough to work with Dr. Richard W. Parkinson. So he was a new consultant at that time, in 2000. But he eventually went on to become the British Society president, because a very committed, passionate knee surgeon, and he loved cricket. And my name being Srikanth, like Krishnamachari Srikanth, we connected, and he used to take me to his private list and all. And he was another inspirational person. And if I'm a knee surgeon today, I love the passion. It's because of him, Mr. Richard Parkinson, who was also voted. He was the British Knee Association president from 2014 to 16, and voted the top 10 best knee replacement surgeons and trainers in the UK. So he was not when I met him first time in 2000, but he went on to become a great surgeon. And he was an inspiration for me to, take up orthopedic surgery, and particularly knee surgery, knee as a passion. Yeah.
Okay, so your specialization is only knee, so you don't work with any other joints of the body?
Yeah, I mean, so you can put it as a super specialist for the knee, because okay. I almost you can say knowledge there is no end, but but right. Sometimes you are closer to the end of the knowledge. So as far as knee is concerned, that's where where I am, because I do like augmented reality and mixed reality, which even people don't dream, and nobody's doing in Bangalore, Karnataka. Only few surgeons in India are doing. So this is much beyond. I'm been doing robotics for last 2 years, but I've started doing robotics in last 6 months in Bangalore. But I've gone one step further. I'm into the next zone, and always, as far as knee is concerned, I will remain one step ahead of the game. Okay. But yes, I do hip surgery, I do revision, I do sports injury, I do trauma as well. I do regenerative medicine, which is another passion. I'm introducing new technology in Karnataka called the joint VEDO for that. So I'm doing all the other things as well. But this is my area of, you can put it as a super specialist area. My passion is about knee surgery and the problems associated with the knee joint.
Yeah. There's so many different, like I had an ACL tear back in 2000, year 2000. And I remember going down the rabbit hole of understanding about knee surgeries and things like that. And one of the themes that emerged from my research was that the knee is, I guess, the most complicated joint in the body. Is that still true?
Absolutely. You hit the nail on the head.
Okay.
What you're telling, many orthopedic surgeons, locally in Bangalore don't understand that. Now, last 10 years, that's been my campaign to make them understand that knee is not a simple joint like you see in the X-ray, but knee is a complex three-dimensional hinge. And I might have given more than 20 talks to just orthopedic surgeons in India and Karnataka and Bangalore, trying to make them understand that the knee is a complex three-dimensional hinge. There are so many ligaments working in the knee, And many of the role of the ligaments, even in 2023, we still don't understand, and
wow.
that's how fascinating the knee is really. And yeah, it's just amazing that as a patient journey, you understood something beyond which many of the juniors don't, as doctors and surgeons don't understand in Bangalore or Karnataka or India.
Yeah, can you talk about like you talked about the joint VEDO and robotic surgery and things like, can you just kind of give a quick introduction into what robotic surgery is? I guess most people are up to speed on arthroscopic surgery. That's kind of, I guess, been around for a while. Can you kind of walk me through what robotic
Yeah.
surgery is?
Before going to the surgical aspect, we always try non-surgery. So I'll first talk a little bit about the joint VEDO, which is a new technology that my center launched in Karnataka for the very first time. And these kind of new technologies emerged during the COVID time because all the doctors, everything was shut. I mean, so COVID basically shut the whole world down, and only a few hospitals worked because they were essential, and maybe agriculture worked, that kind of a thing. So during that time, many of the experts were also like forced to like Zoom meetings and that kind of a thing. So it sort of gave them an opportunity for creativity to think out of the box and see what could be done. And knee cartilage or cartilage in the human body, the articular cartilage has been a very vexing problem for the doctors and the surgeons for centuries. And still very fascinating. We still don't know how it works, why it works that way. And I think around 3 years ago, during the peak COVID, I think first wave, I was involved in a meeting pan Europe where all the top knee experts and regenerative medicine experts were having a Zoom meeting. And the first time I heard about this new concept, where the fat of the human body can be taken, and the cells from the fat can be harvested, and those cells can be a game changer in the treatment of arthritis. Where you don't need robotics, but that's one end of the spectrum, where you can treat the knee arthritis without actually surgery, with a very minimal, less is more, that kind of a concept. So that's the first time I heard. And then, I subsequently heard again a year and a half ago, because I'm quite academic, even during COVID and everything is shut up, I organized around 4 international meetings, in the country.
Wow.
And my center trained around 10,000 orthopedic surgeons in India and Southeast Asia. So it was a huge kind of accomplishment for a small unit like myself. So that was really fantastic. So during that time, one of the meetings, one group of scientists, they came and presented their work, and I was really blown over by the kind of academic acumen they had and things like that, where they were looking at this fat and manipulating the fat minimally and getting what they call as the SVF, and then sort of grafting it into the knees and getting a good outcome. And I'm a very passionate believer of evidence-based medicine. I look at all the papers, the statistics, whether they've done it right, is there a con involved, or is it genuine? So I really go to the end of the thing, the end of the earth, to make sure the technology is right for my patients. Then I realized that this is really good, and they are applied to the government of India, DCGI, which is a regulatory authority like FDA. In the US, they approved it, so they would not approve it without evidence because there might be legal issues. And all the insurance in the country had approved it except Star Insurance. Again, the insurance will not approve unless it's legal and legit. Otherwise, patients can sue, doctors can sue, everybody can sue. So that sort of gave me confidence that yes, these people are barking under the right thing. And when I introduced in Karnataka, I named it as a joint VEDO. It's a Hungarian name. VEDO means protector, joint protector. And I launched it here in Richmond Road, here in Bangalore. And my center has got exclusive rights, from this Australian company to do this. And what we really do here is we take the fat from the abdomen, because most of the people have abdominal fat, around 300 ml. And we use a patented technology from Australia. And then we process the fat, and then we get this what we call as stromal vascular factor. And, we sort of inject this or, graft it into both the knees. And this seems to be producing like a game changer really, because knee has got, if you look at the 3D printing of knee, which is the next new thing coming in future, they need a matrix, extracellular matrix, that's a scaffold. People use a biogel in 3D printing. So this joint VEDO has got that, the extracellular matrix. Then they need cells, which are important cells. So we got here called pericytes, which are the key cells. And then you need, the signaling molecules called as the cytokines. And this joint VEDO has got that as well. So all the three components of tissue engineering is actually present here, and that's why it is producing a fantastic result. Unlike local anesthetic injection, which was there in the past, unlike steroid injection, which was there in the past, unlike the PRP, which was there in the past, this is turning out to be a game changer. Actually, I've used in several patients. They're extremely happy. They're ecstatic. So we're trying to educate the local GPs to understand about it. Where if patients can avoid knee surgery, that is a fantastic thing. Rather than replacing, regenerate the joint. That's the kind of mantra which we have been pushing actually. So it's done extremely well actually. I'm very pleased with the initial experience of the patients, how this technology is working. For those who speak the local language Kannada, I will say ಈ ಹೊಸ ಜಾಯಿಂಟ್ ವಿಡೋ ಅಂತ ಒಂದು ಸಿಸ್ಟಮ್ ಇದೆ. ಅದನ್ನು ನಾವು ಆಸ್ಟ್ರೇಲಿಯಾದಿಂದ ತಂದಿದ್ದೀವಿ ಬೆಂಗಳೂರು ಕರ್ನಾಟಕಕ್ಕೆ ಫಸ್ಟ್ ಟೈಮು. ಸೊ ಇದರಲ್ಲಿ ಏನ್ ಮಾಡ್ತೀವಿ ಅಂದ್ರೆ ನಮ್ಮಲ್ಲಿರುವಂತ ಕೊಬ್ಬಿನಾಂಶ ಇರುತ್ತಲ್ಲ ಹೊಟ್ಟೆಯಲ್ಲಿ, ಅದನ್ನ ನಾವು 300 ml ತೆಗೆದ್ಬಿಟ್ಟು ಈ ಪೇಟೆಂಟೆಡ್ ಟೆಕ್ನಾಲಜಿನ ಯೂಸ್ ಮಾಡಿ SVF ಅಥವಾ ಜಾಯಿಂಟ್ ವಿಡೋ ಅಂತ ಒಂದು ಬರುತ್ತೆ, ಆ ಸಬ್ಸ್ಟೆನ್ಸ್ ನ ತಗೊಳ್ತೀವಿ. ತಗೊಂಡು 2 ಮಂದಿಗೂ ನಾವು ಗ್ರಾಫ್ಟಿಂಗ್ ಮಾಡ್ತೀವಿ. ಗ್ರಾಫ್ಟಿಂಗ್ ಮಾಡಿದಾಗ ಏನಾಗುತ್ತೆ, ರಿಪ್ಲೇಸ್ಮೆಂಟ್ ನೀವೆಲ್ಲ ಕೇಳಿರ್ತೀರ, ಮಂಡಿ ರಿಪ್ಲೇಸ್ಮೆಂಟ್, ಮಂಡಿ ಚಿಪ್ ರಿಪ್ಲೇಸ್ಮೆಂಟ್, ಇದು ರೀಜನರೇಟ್ ಮಾಡುತ್ತೆ. ಸೊ ಅಂಡ್ ತುಂಬಾ ಬೆನಿಫಿಟ್ಸ್ ಇದೆ, ಯಾಕಂದ್ರೆ ಇದು ಡೇ ಕೇರ್, ಬೆಳಗ್ಗೆ ಬಂದು ಸಾಯಂಕಾಲ ಹೋಗ್ಬೋದು. ಮತ್ತೆ ಇಟ್ಸ್ ಆಲ್ಮೋಸ್ಟ್ ಸ್ಟಿಚ್ಲೆಸ್ ಸರ್ಜರಿ, ಅಂದ್ರೆ ನಾವೇನೋ ಸ್ಟಿಚಸ್ ಯೂಸ್ ಮಾಡಲ್ಲ. ಸೊ ಅಷ್ಟು ಸಿಂಪಲ್ ಆಗಿದೆ. ಅಂಡ್ ಸೇಮ್ ಡೇ ದ ಪೇಷಂಟ್ ಕ್ಯಾನ್ ಗೋ ಹೋಮ್. No major anesthetic kind of involvement. It's a short stay surgical procedure. They can full weight their mandi marchbodu, chakamaple hakobodu, their puja madbodu. Is a big thing for the Indians.
Right.
I got fear that these things they can't do after a knee replacement, but they can do all those things which they can't do in the knee replacement. So, and because it's an autograft, we taking own body, so side effects are close to zero, almost minimal. So we say that if something doesn't kill you, it makes you stronger. So the joint VEDO is like that. It doesn't kill us, so it makes us stronger. It preserves our joint. So I think it's going to be a game changer as things develop. So anybody wanting this can either contact our center through the website SSOC, through Google, or the Gleneagles portal also they can contact, and they can reach.
Yeah, I'll be putting all the links in the description. Whoever wants to find you can hopefully find you easily, your Twitter handle, all that stuff, hopefully. I had a question.
Technology.
Yeah, I had a question, follow up for you. Like, I guess, can you describe to me what arthritis is for a lay person? Because like 2 years ago or a year and a half ago, I had extreme amount of back pain. And then when I went to the local chiropractor in America, and we could get into that later on, but I went to the chiropractor, he took an x-ray, and he said, you have early stage of arthritis. And it was kind of shocking to me in my neck, and that's what he described. But I don't know what so the way he described it to me was that there's some additional bone growth around like the segments of my neck, and those bone growths are kind of like pinching the nerves and things like that. Can you, I guess, if you can break it down and kind of give me a pretty simplistic view or layman person view of what arthritis is, please?
I think arthritis itself is a misnomer. So I think the right term for it is called osteoporosis. That's the right term. So the reason is arthritis. Itis means inflammation. It means there is inflammation. If there is inflammation, we call itis in medicine. Like vasculitis means inflammation of the vessel. So arthritis means it should be an inflammation. But the truth is that it's not arthritis. It is osteoporosis. So arthrosis means it's a failure. Just like a heart can fail, we can have a heart failure. This is called as a joint failure. That's why the right term for it is called osteoporosis. That means the joint is failing. Okay. So essentially, it is a degenerative process. It's a wear and tear process, typically associated with age, and where the cartilage undergoes a lot of changes. There, it absorbs more water, it becomes more softer, so it loses its properties. It starts getting split, what we call as a fibrillation, and then it becomes like there's a loss of cartilage, what we call as a crab meat appearance in arthroscopy, and then finally the entire cartilage is lost. And I think the articular cartilage, which is a hyaline cartilage, is at the core center of all this disease spectrum, whether in the neck or in the hip or the knee or at ankle or wrist, it doesn't matter. Same thing, pattern is followed. So So what really happens is this articular cartilage is a very specialized cartilage. And the way nature has designed it is unbelievable, because till now 2023, no human is able to crack the code. That is how nature compared to scientists and human beings. So because the cartilage itself sits on the top end of the bone. If this is the knee joint, it sits on top like that, and then this layer is completely one, avascular, that means doesn't have blood supply. Aneural, that means it has no nerve supply, so hence there is no pain. And then alymphatic, there's no lymph nodes there or lymph vessels. And non-immunogenic, that means it doesn't have an immunological reaction, like in a foreign body, it doesn't react. So nature has kept all these things out of it. So because it wants to be like an inert structure, which should help in cushioning and things like that. So if, when somebody walks or runs or does anything on the knee, because this protective layer is there, which doesn't have nerves, which doesn't have blood supply, which doesn't have lymphatics, which doesn't have immune reaction, it basically, whatever you jump, do, dance, whatever you do, there's no pain at all. But what happens in arthritis is that, I mentioned all the stages. So this cartilage is eventually lost. So in the grade 4 arthritis, this whole layer, this layer comes off completely. So
why does it get inflamed? Why do we start losing it? Well, I mean, how? What is it like a? Is it like a lifestyle choices, or is it other like hereditary reasons, genetic reasons?
Yeah, it's basically age-related kind of thing. That's the main reason. So that's why typically, if you look at any arthritis or something, or hip arthritis, it is those people who are 55 plus, maybe 55 to 75, 85. They are the group which get affected. So that's one of the fundamental reasons why it happens.
So it's inevitable. So everybody will eventually.
Inevitable. Yeah. So everybody will have it at some point. And when it becomes a grade 4, where the complete loss is there, then the bone is exposed, subchondral bone, which has got nerves, and the two bones with the subchondral nerves rubbing on each other, that causes the pain, because the painless structure is removed. So now the painful structure are coming in contact. So, and then that causes the pain. So, but as you asked, there may be other causes also. For example, there is a young person who has a fracture to the leg. Okay. And then in India and in Bangalore and Karnataka, very common to go to some kind of a Kayandi Papana or something like that, traditional bone setters.
Right.
They don't have a scientific method. They, by their experience, they try to set it. Sometimes it is not set. Maybe 8 out of 10 times it's not set properly. So you're basically abnormally loading the joint, really. So once you abnormally load the joint says, no, I'm not designed to these abnormal loads. I can take normal loads if he has done a perfect job of aligning the bones perfectly. But this fellow has not done it. Maybe 20% is done it. Lucky. They go on, they become the brand ambassadors in Karnataka for this bone setter. And all the people, 50 rupees, people think, okay, 50 rupees, okay, even if my leg gets spoiled, that is the kind of mentality. Man. So what happens is that the joints get low, wear and tear, and once it's completely lost, they get arthritis. So this is the fundamental mechanism. So, if there is a young person, abnormal loads, he can get it. So what we call as a secondary arthritis. So first is the primary arthritis. Then there is a group of arthritis which are actually, you can call it as a, inflammatory arthropathy, like rheumatoid arthritis, what is called Sandhivayu, in Kannada, back pain related arthritis. So this whole spectrum of arthritis also, which can cause knee and hip problem and neck problem and things like that. So we basically divide it into primary osteoporosis, which is a degenerative process. Then, it could be inflammatory, it could be infective, it could be post-traumatic. So like that we classify and we go accordingly. So that covers the whole.
I wanted to ask you, like, really quickly on this Nati Vaidya aspect of things, where you said 8 out of 10 are not done properly. That's jaw dropping, right? Like I have to pick my jaws off the floor to contend with that. I can't imagine. So this is another quick anecdote. I was in Jayanagar, and there was this guy with extreme speech impediment, and he was in his 20s, and I was asking him, have you shown it to a speech therapist? Have you had some kind of corrective therapy done? And then he mentioned to me the same sort of thing. He's been to Nati Vaidya. They've done a bunch of Ayurvedic things. It hasn't really worked. can you maybe talk, maybe today, can you maybe talk to me about, do you have any like solutions or intuitions about what we could do about that sort of thing? Because that, I mean, in the big picture, that is going to always impede us as a country, like as far as living healthy, being healthy, having better outcomes in life and things like that. And I understand folks in the villages, and people can't afford some of these surgeries. They can't afford to come to big hospitals and so forth. So they do it for that reason. And then there's a distrust of Western medicine, quote unquote Western medicine, and stuff like that. I'm sure you've thought about this. Do you have any kind of intuitions to talk? Do you have any thoughts on that?
Yeah, I think, so I can sum all the whole thing in one word called health illiteracy. So in India, I think health illiteracy is a very big problem, maybe 80-90%. Even educated people, even people who have qualified, done BSc, MSc, BE, so many things,
Wow.
everything. It surprises me. It really surprises me because
Yeah.
reason is very, very logical, very, very, 2 + 2 is 4, that kind of a thing, really. And now we have got evidence-based medicine. You can, if you're really good, you can Google it or PubMed and find exactly what is the treatment, what is the stage, is it stage 1 arthritis, 2, 3, 4. For each one, there is a definite clear-cut guidelines, and there's no confusion. Okay. So having said that, still, our country, around 90-95% is filled with health illiteracy. That's why they run to this one. And it's not just about the village people who run, even educated people run,
Sure.
I'm really surprised. Sometimes patients do come to me and they come and say, sir, I want to go to this Nati Vaidya in Mysore who treats my neck pain. And please write down, write down a prescription for the neck x-ray, because my Nati Vaidya, who's basically a quack, is busy. Okay, because he sees 100 patients a day and charges 1,000 rupees per patient. Okay, and he doesn't have time to do a form for my x-rays. But I, as a super specialist, should sit here and do a form for him and charge 500 rupees, and he calls me as a looter. You understand where I'm coming from?
Yes.
Quack in Mysore, pay him 1,000 rupees, wait whole day, okay, get treatment, and rather than come to a specialist and get it treated. This is, if I don't call it as health illiteracy, I can't call it as anything else. Okay, this is what. Okay, but there are several reasons for that. As you mentioned, quite a few things. The problem is, again, comes back to leadership, because the role of the leadership is to understand, okay, what is our population? So we are the largest populated country in the world. Okay, what are the common diseases that we have? Which area of the country has got these diseases? So what is the kind of skill set we need for this area, say Assam, Kerala, or Bangalore, or Karnataka? How many doctors should we produce logically for this disease? Somewhere too much of cancer is there in Kashmir, Kangri cancer or something like that. How many cancer specialists do we need in Kashmir? Okay, in 5 years, 10 years. This is how healthcare is planned in the developed country. None of that happens in India. It's very, very ad hoc, very, very, they don't have a vision. Oh, I'm here for 5 years, how much money I can make in 5 years, and go. And I'm sure the next government will come and undo all the good schemes that I have done.
Yeah.
Problems. The next government comes, they have to, because they're opposition party, they have to oppose all the good things that the previous government has done. So if this kind of third world mentality is there and leadership, then the country goes nowhere, because somebody is pulled in one direction, the opposition party comes to power, they pull exactly in the
nullify the whole thing. Yeah.
They'll stay in the country, stays here. It doesn't go this way, it doesn't go that way. But if they have a constructive approach and they say, yes, I might hate this guy, Prime Minister, I might hate him to his bones, but he has done some good things. Now I'm the Prime Minister, I'm from the opposition party, but he has done some goods. Let's support some of these and let's push the country forward. Then there's a future for the country. Okay. If they say, okay, for the hell, because he saw a different party had to do opposite, then there is no future. And then this kind of health illiteracy, 95% will become 100%. Okay. Even among the educated. So I think, yes, that's, we don't have the enough number of doctors. That's the problem, qualified doctors. And second is that healthcare is expensive. Okay. Government, in a way, in India has washed its hands of the healthcare service. Okay. Because I come from NHS, which is UK, where 95% of healthcare is done by the government. Okay. So, and healthcare is like sacrosanct in the UK. And if any government, that Labour or the opposition conservative say that we will take NHS off from the people, they will get booted out of power by the power. They kick them out. They don't care. All the babus will go, netas will go if NHS is touched. NHS is like almost like a SC kind of thing in India. You can't touch that segment. If you touch, you're in trouble. You'll be in jail. So NHS is like that. So I think that has to happen in India. Healthcare has to become the number one issue for the country, and any government which doesn't address the real issue of healthcare should be booted out. Okay, if the people of a country can be educate themselves to that level and do that, India will be overnight developed world. Overnight, tomorrow it will be a developed world. Okay, so till that happens, it's going to be a challenge. So essentially, we need proper leadership who can plan. Okay, in 5 years, I need so many of these specialists in this particular area of India. So then we can change the India. So that's the one concept they need to get. And then they should say, how can we make it affordable? Nationalize the whole damn health. What is the problem? Why can't you nationalize? UK has done it. Nationalize the whole thing. There's nothing wrong in it.
But there's a cost element to it, right?
India, we are supposed to be the most populous country in the world. And we say that we are the fastest. We're bigger than UK economy, blah, blah, blah. But we spend 1 to 2% of the GDP on the health. We spend 10% of our GDP on defense to kill people, to produce a BrahMos missile, to destroy life, to save life. We invest 1 to 2%. What are we as? We are worse than Bangladesh and Sri Lanka. Sri Lanka is in crisis. Pakistan is in crisis. Okay, they are burning. They don't have money. But our investment in health is worse than Bangladesh and Sri Lanka. This is where we are. We say we are the most developing country. Now we are like number 2 or 3 in finance. I mean, come on, it doesn't add. 2 plus 2 doesn't add. You need to really think and say, hang on, we got most populous country, 1.5 billion people. We have to invest in health. We can't have 1-2%. We can't have lip service. We have to invest maybe 10%, of the GDP. Like we're using it to kill people, using BrahMos missile, this missile, that missile. And now I think there's an article that India is investing some $45 billion, something like that, some crazy amount on the killer drones, the predatory drones that the US is selling. You might know, the predatory drones, they've got a specific name. I don't get it in my tongue now, but they're investing $45 billion for a predatory drone to kill the enemy, but they're not investing even 3% of the GDP to save the lives of Indians. So this is where the problem is really. So make the healthcare affordable by putting money in the healthcare. Okay, then doctors will go to remote villages. We'll see, because they're paid well. Why they will not? Why they will not? If you pay them like pittance, like a beggar, why will they go? They've got a family to look after also. They're also human beings. They also need money, just like our ministers and babus need money. So how can they go to villages and serve? You don't pay them. So this is the reality. All the jobs in the villages, they're contract. That means 6 months, then you have to go to Babu, drive and get one more contract. And it continues for 10 and 20, 30, 40 years. Nobody wants to give a permanent job to a doctor or a teacher, because that means a drain on the resources. That means no chance for corruption. So where I'm coming from. These are the fundamental problems. And hence, the people in the village, if I go to Bangalore, I have to spend time.
I'm so interested in what you have to say, Dr. Srikanth. I think we got cut twice. I think I don't want to miss out we missed out some of the things we're talking about. And these are some very serious topics. And I don't want to be at the mercy of this bad connection. How about I come to Bangalore, and when it's convenient to you, we can have a follow-up?
Yeah. Because now it's around 1:20 now, it's lunchtime, and apparently today is Father's Day. So I have to take my
Happy Father's Day.
And, for a movie, we're watching this, Adi Purish, it's about. So let kids learn some idealism, at least in a very world filled with negativity and nuclear war and all. So at least let them learn some ideal stuff. So this is a good thing. So I think we can call it a great day today. And maybe when you come to Bangalore, we can sit face to face and continue. And there are so many layers to explore really, because I genuinely want to change my country. I really am passionate about India, and in fact I tell that there are more patriots in UK and US, in Europe, in Australia and New Zealand than in India. People get very upset with me. They say, Srikanth, how do you say that? But that's the truth.
Yes.
There's so many people who love India, like absolutely, in the UK, in the US, in the Australia, and our people, don't want to recognize that. They say, oh, these people have left the country for money. Okay, that's fine, boss, because you didn't give the opportunity for them to stay here.
Right.
Okay, you don't want to look at that. You just say, oh, they're making money because you're jealous. But they genuinely want to do good to you. while you are indulged in corruption, more corruption, freebies and this and then looting the country. What is the point? How will the country improve? Good for the country, even though they may be outside the country. So, that's the way. Okay, let's connect again once you're back, and we can explore these issues further. Okay?
Yes. And yeah, thank you so much for your time, Dr. Shrikanth. I'll keep let's continue this when I get back. These are some very serious topics that I'm so thankful that you brought these up. Like, I wanted to hear it from the horse's mouth, so to speak, that, some of these issues like you're talking about, where, you have this ad hoc planning, or we really don't have an advocacy system where, there's these kind of ideas kind of percolate from the bottom up, from the doctors and all those communities back, and advocate for things that make sense versus a small group of people. All of these topics, and even like, I think I missed out on some aspect of what you were saying with the health illiteracy, and that seems very fascinating to me. It's something that I feel like we should attack like right now. We need to talk about it, because I hear it all the time, and it just shocks me. It pains me to see that like outcomes are really bad. Even that 8 out of 10 stat that you were talking about, people going to Nati Vaidya and all that, like, oh my God, there's so many different ways we could get into. I appreciate your time. I'll let you go. Thanks to Dr. Shrikanth. We'll talk soon.
Thank you, Raju. Thank you so much for your time. And we will connect again.
Okay. Likewise. Cheers. We'll talk soon. Thank you. Cheers.
Have a good day in the Himalayas.
Thanks. Thank you. Thank you. Bye.